One of the biggest anxieties patients have about eyelid surgery is not about the procedure itself, but the recovery. Many people ask, how long will I look swollen? When can I go back to work? When can I start exercising? Or how bad is the pain? And what if it doesn't heal properly? Hi, I'm Dr. Stephanie Young, Senior Consultant Oculoplastic Surgeon practicing at Eagle Aesthetics and Surgery. Today, I want to talk honestly about what recovery after eyelid surgery is really like. Not just the physical changes, but the emotional experience as well. If you are looking to undergo surgery to address your eyelid concerns, understanding the recovery process can help you feel more prepared and less anxious during healing. Before we begin, be sure to subscribe to our channel to stay updated with us on all things aesthetic, eyelids, and plastic surgery. Recovery after eyelid surgery is not a single moment where everything suddenly looks normal. It is a gradual process that happens in stages. Swelling and bruising are expected, and they do not improve in a linear manner. Some days look better, and other days may look slightly worse. This fluctuation is normal and does not mean something has gone wrong. Most patients are surprised by how much healing continues, albeit slowly, even after the early visible swelling has settled. In the first week after surgery, swelling and bruising are usually at their peak. The eyes may feel tight, heavy, or slightly uncomfortable rather than painful. Vision is generally unaffected, although patients might complain of some blurred vision due to the ointment getting into their eyes and affecting their ocular surface. Some dryness or mild irritation can also occur. It is common for patients to feel self-conscious during this phase, even if healing is progressing normally. Rest, gentle care, and following post-operative instructions play a big role in supporting this early stage of recovery. After the initial swelling begins to subside, patients often feel more comfortable returning to work or social activities. However, this does not mean healing is complete. Subtle swelling, asymmetry, or firmness can still be present, especially in the mornings. Scars may appear pink or slightly raised before they gradually soften and fade. This is the wound remodeling phase, and on a microscopic level may take 6 months or more to completely heal. This phase requires patience. The eyes are healing beneath the surface, even when outward changes are less obvious. Final results from eyelid surgery take time to fully settle. Even after swelling has mostly resolved, subtle refinement continues for several months. Scars continue to mature and tissues gradually soften. Over time, the eyes usually look more rested and natural rather than operated on. The long-term healing phase is an important part of achieving a balanced and lasting result. Because the eyes are such a focal point on the face, even subtle swelling or asymmetry can feel very noticeable. What I often reassure patients is that healing around the eyes is rarely symmetrical or predictable in the short term. One side may settle faster than the other, and certain areas may feel firmer or look uneven before they soften. These changes usually reflect normal healing rather than a problem. That said, recovery should never feel like something you are navigating alone. If something does not feel right, or if you're unsure whether a change is part of normal healing, it is always appropriate to ask. Open communication helps ease anxiety and allows concerns to be addressed early, even when everything is progressing as expected. Recovery after eyelid surgery is a gradual process, and some fluctuation during healing is completely normal. While it can feel unfamiliar at times, it is important to remember that eyelid surgery is generally very safe, and most patients heal well when it is performed by a skilled surgeon and when post-operative instructions are followed carefully. With time, patience, and proper care, the eyes usually settle into a more rested and natural appearance. If you are considering eyelid surgery and would like to discuss the procedure and recovery in more detail, speak to us or arrange a consultation. Clear expectations and personalized care make the entire experience far more reassuring.